So welcome everybody to today's very interesting conversation. My name is Sanjana. I'm one of the founders of Miyara. And for those of you who don't know Miyara, we are a health platform for women in midlife, supporting women through menopause, transition, and beyond. And I will just put some links so you could reach out to us directly if you want to know more about what Miyara offers. But let's go head on to today's conversation. So today we are going to be talking about bone and muscle health in midlife, and we have two great speakers with us, and we're going to have a great conversation. But just to, before I introduce them, I just want to kind of set the stage on why this conversation is important. Now, I've been looking at facts about bone and muscle health and osteoporosis particularly, and I just came across a statistic which said 61 million people, and if we're talking about India, in India have osteoporosis, and 80% of them are women. So one thing I would like to say is osteoporosis is more common in women than in men. And there are multiple reasons for this. And one of these is the low estrogen during what happens during menopause. And another fact is women lose muscle mass at the rate of 3 to 5% every decade after they turn 30. And hip fractures is another thing which is more common in women than in men. So this is the kind of context that I want to set before we, dive into this conversation. So what are the different steps to prevent these kind of statistics and from a fitness and from a medical perspective? And that's why happy to introduce our speakers today. So we have with us Dr. Parthasarthy Srinivasan. He is among the select few surgeons in the country with a national board certified 2-year fellowship training in spine surgery. He has studied medicine from Kasturba Medical College in Mangalore, and right now he practices as the head of the Department of Orthopedics in Dr. Mehta's hospital in Chennai, and a consultant spine surgeon at Rela Hospital in Chennai. Not only that, what is interesting about him, he's a big fitness buff and has completed 2 full marathons, 7 half iron triathlons. So we're very excited for him to put the medical and fitness context into all this. And at the other end, we have with us Anupama Gopal, who's a fitness and lifestyle coach. She's a Pilates master trainer and has trained from one of the living elders, Lolita San Miguel in Florida. Michael King, and a wide variety of renowned Reebok Global Masters as well. So not only has she is into the Reebok Step program, has been her longtime favorite until the Iron Bug hit her, and her current favorite is powerlifting. So very interested to get both your perspectives and have this conversation with you.
Thank you, Sanjana. Hello, everyone. We've been looking forward to this evening's conversation for a very, very long time now. And one of the biggest reasons is Dr. Partha here. I don't know how you feel about this, doc, but Sanjana, all that introduction about Dr. Partha being on one side, I think for us as a group of women here, the most exciting thing of having you here in this evening, doc, is about not only having to hear everything that you know about bones and muscles and the orthopedic practice that you're into, but also you're, I think, one of the very few who also does active fitness like no other. So I think that's a fabulous combination for all of us listening in this evening. So let's begin by just asking you, what is musculoskeletal health? For different people, it means different things. But I think a good start point for all of us would be to understand what is it to be healthy with your bones, muscles, and joints?
Right. So first, let's look at health per se. The problem with health right now is it's being defined by either physical attributes, like a six pack or zero fat, zero size zero, etc., which is really not healthy. It may be in a healthy person, but that's not the sign of health. Health is to be fit physically, emotionally, as well as intellectually, happy, and sorted. So all of this means that your stress has to be low. And this is a little difficult to quantify. It's easy to quantify appearance. It's much more difficult to quantify health. We know when we are not healthy. We don't really know when we are healthy. You know what I mean?
True.
It's difficult to say these are the things that you have, these boxes you need to tick off to say you're healthy, because like there are women that I know, around this age group who are healthy because they run marathons. There are people who lift, but one kind of factor goes through all of them. They're also very happy where they are, right? And this is they're satisfied with where they are on multiple fronts. And if you are happy with where you are physically, you're probably also healthy, right?
Right.
And it's difficult to quantify that.
No, absolutely. So I think you actually set the context for this evening's discussion, right? Because a lot of people are still hitting the gyms and health platforms because they want to lose weight and look a certain way. But progressively, with each decade of life, in my own journey and all the journeys of women that both of us know, we find that those yardsticks have all changed for all of us. And I think those of us who have taken to fitness fairly early on, we're no longer looking at the way we look, but we're looking at what we can do with each decade of our life and how we can do that better. So for the younger people listening in today, I think one of the important things is to understand that training and fitness is not just about how we may end up looking. That could just be an outcome of all of the effort that we put in. But fundamentally, it's about being healthy as you defined, Doc. So how do we ensure that the joints and bones and muscles continue remaining healthy as we go through every decade of life as a woman? This again in the context of perimenopause, menopause, and then years after that.
So there's an interesting point you made there about performance, right? People associate health with performance.
Right.
These are two different things. You can perform extremely well in a marathon or a half marathon and still be unhealthy, or on a lot of fronts. You can be injured, you can be stressed out, you can be just plain unhealthy, even though you run marathons or half marathons. And similarly with any other aspect of a single facet of fitness that you take, right? So to be healthy means that you're able to function by yourself completely within your sphere of activity and able to do what you want to do. Obviously, you will achieve things in your specific facet of fitness because you're training for that. So a lot of the times I see women come in who are like, I run, but I'm just so stiff. If I go to yoga, everybody's laughing at me because I'm not flexible. Like, you're not going to be flexible if you're not going to train that. What you train for is what you get, right? So if you want to be healthy, you can either be a jack of all trades, right? But you can't be a master of all the trades. That's not on. You can't like say I'm going to deadlift twice my body weight, run a half marathon, as well as be flexible enough to do everything. That's not on, right? You have to be clear about what you want to get out of your fitness journey. If it is to stay healthy, you don't really need to do so much. You don't have to have instant the physical achievements.
Pictures, yeah, true.
Need that. You need to have a regular exercise program. You need to have a good intake of food, which is reasonably well balanced. Your weight needs to be in check. It doesn't have to be, a bikini model type fitness at all, right? In fact, that's probably unhealthy. In most cases, it is. These people suffer from all sorts of eating disorders. A lot of them do. So let's not discuss this in the context of what are the benchmarks everybody has to achieve. What are the benchmarks you want to achieve? Let's be specific about what you want to achieve, and then you can decide to do that. So if you decide to run a half marathon, run it. Fair enough. You can do it. You need to take some steps towards it. You need to, focus. But you are obviously not going to be able to do some other things as well because you're taking your time to do this. And it's okay. It's all right to not be, at that forefront in every facet.
Absolutely. So I think the key takeaway from this is, excuse me. So for instance, if someone wants to run a half marathon, the primary training will be towards that. And the secondary training, in order to ensure that they're flexible and strong, will be doing some parts of strength training and some parts of yoga or Pilates or something else. But the primary focus will be to run because that gives them the greatest joy. And I think that's the key, like how we set this evening's discussion, and Dr. Partha mentioned it is about finding joy in what each of us may want to do, and it's very different for all of us. So,
And
in
I
my
can't,
own journey,
sorry, Anu, sorry to interrupt you. I
no,
can't
no, no.
overemphasize that. There is no single thing that decides everybody's fitness, right? It's clearly what you love doing. So if your quality for fitness is deadlifting, that's up to you. If your quality for fitness is, some yoga posture, which is phenomenally different, and I don't do yoga, so I'm not going to be commenting what it may be in that pinnacle of fitness, but that's your choice. And it's okay. You don't have to bend or change your line as long as you are happy doing that.
Absolutely. But what it also means is fitness has multiple components, right? There is strength component, there is a cardiovascular component, there is a muscle endurance component, there is a core component. And as I'm seeing this audience, I know there are yoga practitioners, I have long distance riders, I have marathoners, and I have general population women who just want to be healthy and fit. Now, what this means is if you're a rider, if you're a cyclist, the way you train to do long distance riding is going to be very different from a Gen Pop lady here who just wants to remain healthy and fit, and somebody like me who's a powerlifter. Our primary goal is different, but we all also need to train other formats of fitness. So if you just train cardiovascular fitness, then you're not going to be as flexible as you would may want to be, right? So it is necessary that you have a large percentage of what brings you joy and some small percentages of what will give you overall health and well-being of your joints and muscles. I think that's very important. And that journey is going to be long and continuous because what is joyful for us at this point in time may not be 5 or 10 years later. And I think
And
all of us who have invested, sorry, Doc, go ahead.
so sorry. It's the most common case of shifting goalposts. What you want to be from at right now will change 2 years down the line, right? And will change again 2 years down the line, and that's okay. But the way you train will change every time your focus changes, every time your goalpost changes.
I'm
So
going
if
to
we're going,
I'm going to
yeah.
interrupt for a second because see, a lot of people are not even aware that they need to train like bones and muscles. So I think we need to also start from the like what should a 30-year-old be thinking of in terms of
So
yeah.
yeah, I get your point, Sanjana. So the thing is that, like you said at the start, there is a 3 to 5% decrease in bone and muscle mass, and these are interrelated. It's not like the bone, deteriorates separate from the muscle. If your muscle is not working well, your bone will deteriorate. What we must understand is that clearly, if you're going to lose muscle mass, you're going to lose bone mass, and that's not great. The only way you can build muscle mass is resistance training. Let me put that again very, very clearly. Resistance training is the only way to build muscle mass. Where you are decides how much resistance. So if you are a couch potato, even walking up the stairs is resistance training. Body weight walking up the stairs or walking up a slope is resistance training, right? But if you are already running, you are now, what you must realize is that endurance is not an anabolic activity. It is a catabolic activity. It is an activity that deteriorates your muscle mass, though it's much better than being a couch potato, right? So the step you're going to take first is to do something. But if you're going to ask me what is sort of like a baseline that you need to do, I would say walk 3 times a week, strength train 3 times a week, and that's it.
Yeah, we
That's
can.
enough to be healthy, right? As long as your sleep, stress, and your diet are reasonably well maintained, you need only this much to be healthy, right?
To begin with. Yeah.
Begin.
When you start, then you will fall into the way Anu has, or I have, or a couple of my friends who are here. You will tend to move towards something you enjoy, and you will probably also go overboard with it, which we have all done, right? But that's the next step in the journey, and it is a long journey. It's not about some arbitrary end point that you're trying to reach. It's a thing in progress. It's always a work in progress, right? And so when you start, what seems very difficult after some time becomes your warm up. So that's how things progress in general, right? But if you are asking for the people who have never done anything before, this is where you need to start. Why do you need to start there? So clearly, you reach your peak bone mass and your peak muscle mass somewhere between the ages of 25 and 30. Okay. Following that, your bone and muscle mass is going to degrade and deteriorate at around 5.3% a year. But postmenopausally, this can go up to 2 to 3% a year for women. So men get senile osteoporosis because age-related worsening. So their osteoporosis tends to come much later, maybe in their 70s and 80s. But women, because they're losing somewhere around, let's say, a 45 age mean, they start losing stuff at 3%, right? So they're suddenly going to lose in that 10 years post their menopause somewhere between 20 to 30% of their muscle and bone mass unless they're doing something about it, right? So now you're on the back foot. The other reason why a woman in this age group is in the back foot is muscle building is only with one hormone that is not a woman's hormone. You need testosterone to build muscle, and that is going to be less and less and less. So anabolic hormones of other nature are much less, right? So strength training, resistance training will push your testosterone levels up, not to the extent that it's going to change the way your appearance, but it is going to push your muscle building up, right? So this is the reason why you need to stay healthy, right? The other part of it is, why are we losing muscle and bone? You're going to lose muscle and bone if you are catabolic in any way. What are the reasons for you being catabolic? If you're stressed, you're catabolic. What catabolic means is there's a breakdown of muscle, and also because of that, a breakdown of bone in terms of quality as well as quantity, right? So if you're stressed, if you're not sleeping well, if your diet is short, if there's smoking or alcohol involved, and if there is all these high sugary content fizzy drinks are known to also
Sedentary
cause.
lifestyle.
That's this falls into that, right? Whatever is unhealthy, we know it. You know what? You don't need this webinar to tell me what's unhealthy. What tell you what's unhealthy? That's not, that everybody knows it. The
Yeah,
problem
we
is,
know it. We just want to wish it away and look for that one magic wand that can be, yeah.
very commonly when people come to me and I say you need to exercise, so they'll be like, what's that exercise? That bang for the buck exercise. And there is no bang for the buck exercise. There is only an exercise that you have to do every day, again and again and again, till
Yes.
it makes a difference to you.
Yeah, absolutely. So I think one of the things that people look for, and I think we've all been there and done that as well, is that we want something magical to happen every single day. But one of the things that works is only consistency. You have to show up every single day and do the same things over and over again. All those exciting things are only for pictures, for reels, and sorry, for Instagram. But the regular hard work that most people do who have been in fitness for the longest time, you will find that we are doing the same boring stuff. Doc, I'm having to say this because when I write training plans, people often tell me, oh my God, this is so boring. You just gave this to me last week. Or for instance, when I say just walk, your starting point is such that walking is going to make a difference and people find it not very exciting. But it's the
Absolutely.
most
This
boring
is
things that get you off the block.
Yeah, I know. I entirely agree with you. See, the thing is this you need to get a little philosophical with this, right? And the philosophy part of this is that if you're looking always at the destination, you're going to miss the entire point of this, because this is a journey. And you have to enjoy the journey. You have to enjoy the here and now, and not only look at it as reaching one goal after the other. Not at all. In fact, there is going to be, especially if you're in this age group, there is going to be a time, if you're training regularly, that you're going to reach a pinnacle of fitness, following which it is going to deteriorate. You will never be that fast or that strong, or it's obvious. It's just common sense that you will reach somewhere in your 40s and 50s. I mean, if you started training in your 20s or in teenage years, then you will reach your pinnacle of fitness maybe early 40s somewhere, and after that, it's about if you're taking
So
LeBron James, uh, he's 39 or something. Elliot Kipchoge is going to be 40. These are people who are in their prime, but they're also at a point where if you ask them outright fitness, probably not. They know how to preserve their fitness. They're not at
yes.
the fitness. They know how to preserve their fitness so they can do well. That's a different thing. But if you started training after 35, you will hit a pinnacle. That pinnacle is going to happen in this time. And so you need to make sure that you are looking at something else to keep you going rather than keep hitting some personal records.
So there's also a question in the chat, and I think this might tie in. What are the ways to test muscle and bone mass so that we're aware of our starting point? And when should we start testing as women, I would say specifically?
So the simple ones are fat percentage or lean body mass, right? Both of these are tested by these machines that you have in most gyms now. It's not very accurate, but if you're testing on the same machine, it'll give you an idea, right? Obviously, some simple ways. If you're very overweight, it's actually quite simple to use body mass index as well as just your absolute weight. But if you're going to be very particular about it, you would want to know what your fat percentage is and what your lean body mass is. Your bone strength can be checked with a DEXA scan. That will also give you a fat percentage. In fact, the DEXA scan is the best way to check your fat percentage. But having said that, look, let's not get into this nitty gritty without doing all the baseline stuff. If you aren't exercising, what's the point? Right?
I'm so glad you said this, Doc, because I think the whole discussion everywhere with everything is about going into the details even before we start the journeys, right? So people are keen to know about bone density, and not that it's wrong, but it's only after enough work has been done. And if you're a performance athlete, for the general population, I think all of this has come in with so much of social media, right? For general population, which is what all of us are, because we're not competing at any level, I think just going out there and training and finding something that gives you joy and doing it over and over again and finding those little progress markers will be enough indication for all the questions that are being asked. Bones will get strong under resistance. There is something called time under resistance, right? So the bones and muscles will get strong the more you train. So if you're doing body weight squats, for instance, you will find that 15 repetitions over 3 sets is easy peasy for you. So you start lifting weights, and then progressively the weights will increase, and and the body is so resilient that it will adapt to that and get stronger. So getting a DEXA, getting a lean body fat percentage, and all of that is only for those athletes who are in performance sports. So if you're a competing power lifter, or if you're a competing long distance
treatment for it. All
yes.
you need is treatment.
Absolutely.
But here, the interesting part here is that there's a bunch of things here which go straight away to what we've been saying. One is, what would be the top 5 silver bullet solutions? Move, get up and move, right? Eat healthy, sleep healthy. These are things that you know already. I don't need to tell you this, right? Those are the silver bullet solutions. There's no like I said, insta-worthy silver bullet solutions. Now, the other thing here is, are there any external supplements? So now all of this comes down to this. Your body is phenomenal at handling incremental stress, right? So if you ask them to climb one set of stairs, they'll do it once. The next time it'll be easier, right? And then you can make it 2 times, and you can make it 3 times. So there is always, and your body will respond. So the only problem that you face in this age group is starting too hard, too fast, too much. You need to realize that you will be going backwards if you try to do too much in 1 month. Instead, don't set goals of getting somewhere.
Unrealistic, yeah.
Something, right? For a 70-year-old, whoever the 70-year-old is, if you're going for a walk, that's a great start. In fact, at 70 years old, if you can get up and sit down on a dining chair 20 times, you're awesome. It's a great place to start, right? Or if you can climb up a story of steps and you can do it twice, that's great, right? Again, I'm assuming somebody like Anu at 70 is not going to look at that as a performance indicator. But if you've not been doing anything, this is a great performance indicator, right?
No, I think it's important for all of us to understand what our start point is and how old we were when we started. So like Dr. Partha was mentioning, so if some of us have like a 20, 25-year-old training history when we hit 40, in some ways it's a disadvantage. And I'm sure the 40-year-olds in this group who've been in that same bracket will understand, because now we are struggling harder to preserve that fitness, muscle mass, and strength, because the body has already adapted with 25 years of training. As against someone who's perhaps starting at 30 and has got a 10-year training history, right? So it's very different for different people. And I think it's very important that all of us understand it and work with trainers and teams which understand that, because there is no one training plan that will work for everybody. It's very, very critical to understand it, because one of the key questions that we all need to understand is, where did we start and where are we now? And also, it's important for us to realize that with someone with 25 years of training history, there is also that level of, how do I say it, a mental block that comes in, because the body is not responding as much as it was when I was in my 30s and when I was in my late 20s. So the struggles are real and the struggles are much harder. But the key question here I want to ask you, Doc, is a little away from this. A 40-year-old man and a 40-year-old woman are very, very different in this whole journey. So I'm going to use you as an example. You and I train in the same gym. We lift badass weights. You're in your mid-40s. I'm in my early 50s, and we're very different. Can you just...
Huge difference. It's amazing how much more the same interventions respond in a male versus a female, right? Like you go up on the weight so easily, your strength will go up, the muscles start bulging, you start, you're, for a guy, look.
It's a no-brainer for a guy. The woman's struggle is real. And so
absolutely.
But training for so many years, it's fantastic what we're doing.
And I've seen couples get into this fitness together, and the woman will always come back and say, "You just stopped eating for a little while, and we've already lost like 5 kgs. I'm doing the same stuff, and I'm tired all the time, and I'm not able to lose even a kg of it." This is very, very, very common, right? And you cannot compare your journey to a male of a similar age group, because the male is still producing anabolic hormones, and so he is going to get a better response from any stimulus than you are. But that's why the comparison should be only with yourself. The minute you compare with somebody else, whoever that somebody is, you have to factor in that muscle building needs nutrition, sleep, and training. It reminds me of something that they said, where you can work out in the gym, but if you don't recover, you're not going to build anything. If you're overtraining, if you're just doing too much, you're not going to build anything. You need to rest, you need to get back all your protein in, and there are a lot of boxes to tick, right? So if you're not gaining muscle, you need to sit and problem solve it, not blame it on hormones, but problem solve it, number one. And number two, don't compare with anybody else. There's genetics in play, there's hormones in play, there is personal stresses in play, and not one person in this room can compare to any other person in this room, right? We are all very, very different. Not just the male female thing. There's what your stresses are you a working woman? Do you have children at home? How old are your children? Are your children in college? Are your children still going to school? Makes a huge difference to how much time and energy you have in the day, right? Our body is built to take X amount of stress. Any stress more than that will lead to breakdown, right? And what people think is training is the only stress they have. Really wrong. The stress you have is performing at work, at home, for your children, for your maybe for your spouse, for your in-laws, whoever else is creating all the stress around you, right? And usually people don't take that into account. You can't work the whole day, go to sleep at 11, and suddenly want to wake up at 5 and run a half marathon and expect to do it well also. It's not possible. You have to make sure that your overall stress is also offset with adequate recovery from that stress, and that stress is not just training.
Yeah, absolutely.
Also, what it means is you don't want training to become an additional stress. So all these comparisons between people of the same genders, of opposite genders, are all irrelevant. It adds up to stress. And like Doc was mentioning, most of the muscle building happens in the plate, the food that we eat, and in the bed, the amount and the quality of sleep that we get. It's only a small percentage that actually happens in the training room. The rest is outside of that. So the question now that I think for most people will be, is it okay to start training when I'm in my 40s? I have never trained earlier. It was not important. Now I suddenly find that every doctor I meet wants me to start getting on a training journey. Am I okay to start when I'm in my 40s?
There is no wrong age to start. There is no wrong age to start anything, right? Please don't let anybody tell you your knees are bad, your spine is degenerated, so you shouldn't lift anything, you shouldn't. Oh, please, these people just need to come and do. I mean, if you're, the commonest thing is they will tell this to somebody who's a homemaker. And this homemaker's been carrying the kids till they were like 5 years old, also, they've been carried. And, they're 25, 30 kg kids. How the hell did you carry them? You were strong enough to do it then, right? Even just common stuff, work at home, lifting suitcases, lifting
cans and gas cylinders and buckets of clothes and everything. Women do it all the time. Grocery bags.
Actually, the stimuli that you need to be looking for if you're doing a desk job instead of being a homemaker, or if you're doing both, wow. But if you're doing a desk job, you need to find that stimulus. So you need to go to the gym. But none of these factors that I mentioned, degeneration, arthritis, are against you starting training. What it means is that you need to modulate your plan towards you, right? So that for that you may need a coach, especially if you started your journey and you're keep running into roadblocks like injuries, because there is a certain threshold at which you can break down much easier in your 40s. So if you suddenly, very commonly I've seen people, I want to lose weight, so I started walking. They started walking, you ask them how much they walked. They said, I walked 1 hour every day for the last 3 weeks. Now what's happening? My knees are hurting. Your knees are not hurting because you have arthritis. Your knees are hurting because you just did a whole lot of activity without getting yourself accustomed to it. Cardiovascular fitness is easy to achieve. You get on a bike, you start walking, you start running, you will be less out of breath very, very quickly. But for your muscles and bones and joints to take repetitive stress, if you cross that threshold, you'll be injured. You have to do it very, very slowly and judiciously. which is why when most people ask me for a plan, I will just tell them first 3 times a week, walk 20 minutes. Like just 20 minutes. Like that's all you need. Get into the rhythm, the routine. Because if you run into an injury, it's a setback. It's like 3 feet back, 1 feet up, 3 feet back, and you're just losing it. That's not, that doesn't help you at all. And it's very, very demoralizing to be injured. It is a huge mental discipline because usually people who get into fitness are very focused, very disciplined, and really, really try hard. And when they run into an injury, they just don't know how to back off from that. They're still driving themselves and they're just digging a deeper hole. So clearly, you can start at any age, but if you are starting past the age of 35, you are overweight already, start very judiciously. Be slow. The idea is not to get better in a month, the idea is to get better in a few years, right?
Yeah, so the concept of progressive overload is something that is used quite commonly in fitness, and that applies, like Doc was mentioning, across all formats of training. Cardiovascular, even if you're doing yoga, you don't do a whole bunch of asanas on the first month. You ease yourself into it and make sure that the overload, the stressors that you're putting on your joints and muscles are progressive so that they adapt and get better over a period of time and for the longest length of time. So that is the way we approach training. But this is also a paradox, Doc, because not everyone like you recommends for people to be training even when they identify or they're diagnosed with, let's say, osteoarthritis or degenerative issues. I think the commonest thing for people to do is to just refrain from any sort of training and just rest. And this, I think, puts a lot of people, especially women, on the back foot, because the more you're staying away from activity and mobility, the harder it's going to become for us to come back into it in any form.
Yeah,
right?
absolutely. So I'm sorry to say that doctors and in fact physiotherapists and a lot of other people who are doling out professional advice, in a lot of cases, will advise rest when activity is the answer, right? See, the expectation also from a patient is they should be absolutely pain free. And Anu, you know better than me that we run into injuries every 3 months anyway. We're in pain every 3 months anyway. Whatever we train with, every 3 months, right? Being a spine surgeon, my weakest spot is my back, right? But that doesn't stop me from training. It just means that I go and do what I can do.
Can you say that one more time, Doc, please, loudly?
Very loudly. No, so everybody who trains also has pains and also has injuries. Nobody is going to be pain free throughout their life, right? It's part of the entire game. You have to have pain, right? It will come. What you want to do is you want to train around it,
around the pain. Yes,
slowly back into it. In fact, a lot of times now it's suggested that you move the joint through the same movement that caused pain, but do it slowly and
gradually. Yeah,
increase it, right? So
right.
if I have an injury deadlifting, it means that I will go lighter on my deadlifts or I will hold off on the deadlifts alone for a little while.
But do something else. Yeah.
I will still do something.
Right.
Something is going for a walk. It's okay. You are never going to be absolutely pain-free.
Yeah. So that's a very fine line, I think, for everybody listening in. So here we're not talking about acute injury and pain. We're talking about little niggles, like DOMs, like soreness, and things that will keep happening if we are training on a long-term basis. If there is an injury as well, then work around the injury. So if there's something happening around your shoulder, nothing prevents us from doing lower body workouts. Or if there is something that is happening in the lower body, you still go and do as little as you can. But it's important that you stay mobile as much as is possible and train, because that's the only way healing will happen. Because the concept of active rest is real. Except when the injury is very, very serious and you've been advised to remain in bed and absolutely inactive, even after surgeries. I think the surgeons very quickly want the patients to be mobile, right? You get out of bed.
There's a point here. There is enough evidence scientifically to say that even if you have a really bad back, you have a disc prolapse, which is pressing on your nerve, you've got whatever, absolute rest is 1 or 2 days. Then you are advised to move and move within zone of comfort and keep increasing that. Now, here's somebody who's asked me a very interesting question. My exercise, nutrition, mental health are all in place. But quick sprains and strains are a norm since childhood. They're a norm for all of us, meaning you will get injured off and on, either freak accident wise or for the fact that on that day you were not ready to do that much. So the biggest discipline for somebody like Anu would be, today I'm not feeling good, so I'm going to back off and I'm not going to try to hit that max that I'm or whatever is written on my program. I'm going to just take a step back. Good coaches understand that and they're okay if you step back and say, I'm doing 1 set less or a little less. I don't feel like running an hour. I'm going to run half an hour, whatever it is. Or even I'm just going to sleep and I'm not going to work out, right? So there is a point at which injuries happen because of overtraining. And if you have everything in place and you're still having these small injuries here, figure it out. If you have small injuries, there must be some linking point for all of this.
Yeah.
Most of
I'm just going to add one thing to that. It might be a good idea to have your plans, your nutrition plan, your stressors, your sleep patterns checked by an external coach, because a lot of times we assume that everything is in order. Only when you have an external person reviewing your plan do we even realize that perhaps it's not the case. There
I
are
think we
stressors in my life.
mentioned perimenopause and vegan also, so it might be just a good idea to just get all your parameters checked. I don't know what the doctor has to say, but
No, not just a doctor, but I'm saying, so if you're thinking your nutrition is on point, it's a good idea to have it checked by a nutritionist. So if you think your mental health is in order, there is no harm getting through a consultant checking whether it's really in order, because all of us at some point believe that everything is working well, yet things are going wrong. And like Doc was mentioning, there are always reasons for why something is not going right. We don't realize it. We need the help of a professional to identify that for us. So that would be the way we look at it, isn't it, Doc?
Point here about the vegan. So I'm like, I mean, my family is vegetarian. I'm not, right? But being vegan, I have nothing against it. The problem is getting adequate protein when you're vegan. It is difficult. It's difficult even if you're just vegetarian.
Right? Vegetarian, yes, yes.
Access to milk and milk products which have more protein than purely vegan. Now, if you are seeing a lot of this, you need to know that on a regular basis, we need 1.5 grams per kg or
Body
there
weight.
of body weight of protein per kg of body weight, and that's not an easy target to hit. It's not. It's just really difficult. Ask anybody who's trying to hit those targets. It is
Stay within
very
the weight limit. If weight was not a concern, then it's fine. But if you also want to keep your weight within a certain limit and ensure that you get enough protein, and if you're a vegetarian, I think it's perhaps the most horrible combination that you can have.
also you will still be able to manage with whey and add your milk and some yogurt, and there are options, paneer, and there are still some options. With vegan, it really cuts down your options, and then you have to look at supplements. Part of the reason why people get injured is because their target should be 1.5 grams, but somebody would have said that much protein is not good for you. I don't know who says this, because the WHO recommendation, and the first thing they'll throw at you is the WHO recommends 1 gram per kg, but the WHO recommends 1 gram per kg to prevent malnutrition. Let's be clear here. If you're below 1 gram per kg, you're heading malnutrition way.
Malnutrition. Yeah.
Not building. So if you're going to build, you will see people doing 2 to 2.5 grams per kg. Just when you put it in numbers, let's say a 50 kg person wants to hit 75 grams of protein. If you're not having whey protein, which will give you 1 scoop, will give you 25 grams. If you're not having eggs, where 1 egg will give you 8 grams, you're not having any milk products, because paneer will probably give you about 15 grams for a reasonable serving, which you can eat without feeling like you only eaten paneer, as part of your meal. Where are you going to get that protein from? You have to look for the source. You have to look really hard. A lot of them do supplements. The vegan athletes that I know, endurance athletes that I know, have 6 different supplements, right? Because they need to hit that, otherwise they get injured. And protein will cause injury.
I want to spend the last maybe 15 minutes on the questions that in the chat. There have been a few, and I think they need to be addressed at one point in this conversation. And one of them was about the supplements. A lot of people wrote in about supplementation and adding calcium supplements post menopause and things like that. If they've not done, I don't know if they have done or have not done training like we have talked about, but would supplementation be something like a quick fix, like a magic bullet?
Never, right? So your body does not take in any nutrient that it does not require. So if your bone is not being challenged, you are not going to provide the necessary feedback for the body to absorb this. So your calcium is as good as you can just take the tablet and throw it in the loo, because it's not going to get absorbed, right? Unless you provide the entire milieu for you to require more calcium. If you're going to sit in the chair all day, taking calcium supplement is going to do nothing, right? Number one. Number two, anybody who tells you that calcium is the treatment for osteoporosis doesn't know what they're talking about, because osteoporosis per se is not a calcium deficiency. A calcium deficient bone is something else, and that happens in childhood, in rickets, or in vitamin D deficiencies, or when they have renal failure as children, where the calcium doesn't get absorbed, doesn't get deposited in the bone. Osteoporosis, where very classically was defined in our textbooks as the bone is normal, there's just less of it, which means that the protein structure is normal, the calcium is normal, but there's just less of it, right? So it's like having a scaffolding, right? If your scaffolding has got more sticks and more ties, it's going to be stronger. Osteoporosis is pulling out more of those sticks. It's still a scaffolding, but it's not as strong, right? Now, what you must understand with calcium supplementing is, calcium is the whole process of getting calcium from your diet to your bone has multiple steps. It has to get absorbed. The blood has to take it, put it into the bone, and the bone has to accept it. Now, for all of these things, there are a lot of feedback mechanisms with multiple different hormones, which will increase the receptors to pull it up, increase the receptors to absorb it, blah, blah, blah. A lot of science there. But the bottom line here is, if you don't need it, it's not going to take it up. So how do you need it? You train.
Yeah.
You create for the calcium to reach the bone. Maybe then, and also your calcium in your blood will never be with outside normal limits. This is for all people who want to check their blood calcium level. Your blood calcium level never goes down in osteoporosis. It may be in the lower part of normal. So it will be between 8.5 and 10.5, but it will be at 8.6 or 8.7. Having said that, the reason why that is because your blood calcium levels, if it dips below normal, will lead to widespread chaos in your body, including muscles not functioning and your heart not beating. So it's life-threatening. All right. So you're never going to reach there because you have osteoporosis. All right. And so supplementing calcium alone is not the answer. If you're doing everything else and your endocrinologist thinks that you are low on vitamin D for multiple reasons, especially because we hardly move out in the sun these days, you may need a supplemental vitamin D. And when you're taking a supplemental vitamin D, you may need to take a supplemental calcium because your calcium requirements go up. But just taking calcium is band-aid on a,
Okay. But That's interesting because a lot of people are in this age group are also deficient in vitamin D. So that's probably also a concern for bone health and
No, but Sanjana, in answering that question, I think you need to look at it in the context of overall training, movement.
Absolutely.
Only then there is going to be a greater efficacy of the supplementation. And very quickly, I'm just going to add one other supplement here, which again is very widespread in social media, which is collagen. There are various pharma companies, there are various doctors, and many people that I know who are just doing collagen without training.
Is
I
that
think,
or the good joints? Which one is it?
sorry, say that again.
Is the collagen for the glowing skin, the strong bones, or the strong joints?
Everything. It's for everything. It's for the glowing skin. It's for great hair, beautiful nails, strong joints, and to lead a sedentary lifestyle. I take collagen.
Yeah.
It's so easy to sell this green tea, apple cider vinegar. It's just easy to sell this. It's easy because then you feel like you're doing something for your health.
Yeah.
Right, and you've just done the band-aid and it's good. It's like, and we're done. But yeah, so let's be very clear about this. All these supplements are not going to help you without you providing the basis for their requirement. So if your joint doesn't move, collagen is not going to be of any help, right? Now, of course, it's not going to prevent arthritis if you're genetically susceptible to arthritis, but I know a lot of people who have arthritis and who are moving well because they're moving, right? There's another question here which 52 premenopause stage, struggling with fatigue, feel that I'm losing my strength through all health parameters. Renuka is a phenomenal runner, by the way, and I know her personally also. See, the question here is this. If you are in the pre and perimenopausal stage, you're going to have a lot of symptoms because of your hormones being haywire. When women come to me in this age group, and I'm just listing off, so you're moody, you cry easily, you get angry easily, you're not sleeping well, some part of your body is tingling, there's some numbness, it's not specifics. Every day you wake up, there's a different pain. These are very common, difficult to pinpoint symptoms of the perimenopausal age group. And when I start listing them, they're like, yes, that too, and that too, and that too. And this is very common, right? Now, for somebody like you who is quite a performer in terms of running, you will find that your fitness will appear up and down, your targets will not be met. You don't need to change your workouts if you enjoy them. You don't need to put such a stress point on achieving some target.
Personal best, yeah.
Because PBs are something that all runners look for. If you're in your case, you're focused enough to know that if you're feeling off, you can just go to sleep and not work out that day. You're not in the category where you need to worry about you being lazy or not fit. So that's okay. But in the context of everybody else, if you are feeling tired, you probably do need some sleep. If you're going to get 20 minutes of activity, it's a different ball game. Get that 20 minutes of activity and then sleep. Right? If you're a couch potato with perimenopausal symptoms, get some activity. And it's good because getting some activity will make you feel better, will also make your mood get better and make you sleep better. Right? Any activity. I'm not going to be specific about it. If you're not doing anything, anything is okay. Right? But if you are somebody who's regularly training, who's working hard on their strength and fitness, at this stage, you're going to find it like swinging all over the place, and that's okay. It's all right. You will go through this and it will change after some time. It'll become more stable, but you must also realize you're at the point where your fitness year on year is going to come down. At some point, you would have reached that pinnacle and you have to come down. So on the measures that you're looking at, you might lose performance. It's okay, right? What you need to do is enjoy the process of keeping fit. If you are focusing only on the end results, you're going to be very, very disappointed.
Yeah.
And that's not necessary.
So I have one question for Anupama, because this is specifically for a 70-year-old who wants to start strength training. Is it it's difficult to go to the gym even for 3 times for them, but they want to start strength training for the 70-year-old. So is this something?
Of course. So, I mean, with COVID, everybody started training at home. We did not have access to big gyms, big, large weights. So for someone who's starting off, whether they are 70 or 50 or 40, training at home is a great start point. In fact, I love the enthusiasm of this person who's asked this question at 70, can I begin? Of course you can. You can begin with your body weight. Like Doc was mentioning earlier, we have tables and chairs and other things in the house, which we can use very effectively to build strength for any age group.
Yeah.
Sorry?
Water bottles. I
Yes.
think we started the COVID online fitness stuff, which we were doing with our gym. It was about doing bicep curls with filled water bottles.
Yes.
Putting, taking backpacks, filling them.
Backpacks and putting books and whatever else you have in the house. So
Find anything to do. The problem, for a 70-year-old, you don't have to go to a gym, but you would be much better off finding a good trainer.
for supervised training, right? So that's the key here. It's not because you have access to equipment, you have access to supervised training. So that is the key here. So a good training plan with someone to supervise how you're doing it. Like Doc was mentioning earlier, it's not so much about what the gains are, it's about also ensuring that we're not doing something incorrectly that may put us in a space of even moderate injury. So that may be the concern.
Yeah.
But if you're someone who is trained and you know your body aware, then nothing prevents you from training at home.
Yeah, one last question for Dr. Srinivasan, and then I would like both of you to give like some more parting words of wisdom, because you've already shared a lot. One question is, I'm 50, exercise and play badminton regularly. Should I do the DEXA scan? So the question is, should one be doing the DEXA scan post a certain age to check for,
It's
how
a good idea to get it once, right? But you're not going to see. So generally, the DEXA scan for once is to know where you stand,
yeah.
right? It'll give you a good idea. You may, if you have been very negligent about it, you may require medical treatment that will be handled usually by an endocrinologist. I prefer to send osteoporosis management to the endocrinologist, and this may require medication. But the medicine is not the answer. The medicine is just one treatment. You still need to do the other things, right? There was another part to this. What was the second part to it? I'm sorry.
Exercise and no, they're 50, exercise and play badminton regularly. So that was the
which is good, great. You will find out that you may have some degree of osteoporosis. There will be some loss perimenopausally. If you aren't doing any resistance training, please add resistance training. The other thing I wanted to add is the reason why you need to get a good trainer is because most gyms treat women in this age group as, you need to just take 2 kg dumbbells. And I mean, I don't think Anu has ever seen 2 kg dumbbells anywhere around, but basically 2 kgs is what you lift, it's a bottle of water. That's not going to provide any stimulus, right? And I do not subscribe to this incremental. If you want to lift low weights for multiple reps because you don't want to bulk up, that's just silly, right? If you're going to a gym, lift weights, lift serious weights. You should be challenging yourself. You should find it difficult to do that maybe 8th rep or 6th rep, depending on your program, which is why you need to get rid of coaches who come with, in commercial gyms without any certification or any precedents there. But I will say this, in your fitness journey, at every stage, when the student is ready, the master will come. You will find coaches, you will grow out of coaches, and you will find new ones. unless your coach is growing along with you. But this is very common. So it's okay to get started somewhere. You will grow and it'll happen step by step. But please get in and start doing something.
Yeah, that's why I will quickly plug in the Miyara program. We do offer fitness, nutrition, and mental health support. And in fact, we do work with Anupama, who's on the call here as well. So if you want personalized fitness and nutrition plans for women in this age group, please reach out for us. The details are here. But the last 1 minute take home message from Anupama and Dr. Srinivasan.
Before that, before the last message, Doc, I just have one other question. And this is actually of two kinds, right? For people who've been training, right, for a length of time, women, when they hit menopause, they find that there is a degeneration of some kind. There is plateauing. There are many things that happen. Is it common? Is it common for, because it's a sort of a paradox, right? We're saying if you train and if you strength train, you're building resilience, your bones and joints and muscles get stronger. But in spite of it, women find that when they hit menopause, that they are dealing with osteoarthritis, they're dealing with other kinds of things. Is it only genetics or are there other reasons? Is it common? That's one question.
Yeah, so let's look at it like this. Arthritis is different from osteoporosis. Arthritis is a wearing out of your joints. There is a genetic basis for that also, but you can wear out. I mean, some of them will need knee replacements at some point in time, etc., etc. But you can still be very active and do that.
Okay.
Number two, right? If you have been regularly training and you are continuing to train, in the perimenopausal period, you will find deterioration in your performance goals because it's simple. If you didn't sleep the last night, would you be able to do a max out lift? Would you be able to do a good run or any kind of performance the next day? You won't.
Not true. Yeah.
So this is a period of stress where there is a lot of stress on the body that is unrelated to your training program. And because you're not recovering from that stress, you are going to perform badly. Right? So every day challenge. So every day the performance will not match what was your expected performance based on your training and based on what happened the last year maybe. Right? And that's going to happen through those 2 years.
Yeah.
Things kind of settle down, and then you might see a more even response to your training, but it may not be as it was pre-menopausal.
Right.
Right. So your ladies first. So you go with your 1 minute wind up.
Okay. Right. So the takeaway for all of us this evening is this. It's actually a paradox, right? So the more we train, the better we get. But menopause is a life stage where things start to feel different. But in my personal experience and all the women, the badass women that I have come across in my training journey, I find that fitness actually helps us overcome this menopausal life stage in working with the symptoms a lot better. Training builds that resilience to deal with menopause in a way that nothing else can, whether it's mental health, whether it's about the physical pain, niggles, and everything. So I think for everybody here who's been training, very well done. Keep at it for the rest of your life. For those of us who are just beginning this journey, I think it's never too late. Movement in its simplest form, I think, is the biggest thing that we can do to our bodies. Because when we cannot move is when we realize how so blessed we are to be able to do it. I think that's really what I have to say to everybody here. So just keep moving, keep training and fitness as a priority. What often happens is as our responsibilities change and increase, we bring it lower and lower till it almost becomes non-existent in our list of things to do. So the more we fight to keeping training and movement in our priority, better it will be for our overall well-being and health.
Awesome. So the points I'd like to make here are: one, pain is normal. It does not mean that if you are fit, you're not going to have pain. You're going to have pains one way or the other, right? The second thing is it's never ever too late to start anything, right? The third thing, and this goes especially for the women in this age group, is what will win is perseverance and persistence, not heroism. So if you're going to start slow, start low, and keep at it. You will reach phenomenal heights, far more than you were capable of, if you do it slowly. Right? This is pretty much like the tortoise and the hare, but that's important. Don't let people pin a diagnosis on you and say, don't do this. Right? You need to find people who encourage movement. My patients post surgery will train in a gym 3 weeks later if they want to. Right? It's up to them. I do teach them basic exercise, but if they say they want to go to the gym, I'm okay with it. The only issue is that they need to find a good trainer. Number 5, a trainer is a phenomenally good investment. A good trainer is a good investment. It's a much better investment than calcium supplements. Right? Keep these in mind. Probably you will end up having more questions. Probably Sanjana may forward some to me. Maybe we can put some things down, as little posts on Insta for all of you, little nuggets of information. If we find some interesting questions that we can give you a kind of simple answer to. But otherwise, it's all good.
Yeah, thank you. I think you made very important points, especially like a good trainer is a good investment. Absolutely agree with that. And also the fact that everybody needs to set their own performance criteria. So absolutely important, because don't compare yourself to anybody else. Everybody in this room is different. So you will have different metrics to touch and reach. So thank you for that. Very interesting conversation. Thanks so much, both Dr. Srinivasan and Anupama. And if you, like he said, if you have questions for either of them, feel free to reach out to Miyara. I've already put our information on the chat. I can put it again. You can also book a free call with me or Gayatri, who's the other co-founder of Miyara, to know more about Miyara's programs and how we can help you. And just happy to have this conversation, much needed in bone health and bone and muscle health in perimenopause and menopause. So thank you so much.